Most people have heard of aneurysms, but what actually are they? An aneurysm is a weakening of an artery wall, and they can occur anywhere in the body. Aneurysms are fairly prevalent. The CDC states that they account for 25,000 deaths per year in the United States alone, and 1 in 50 Americans have an unruptured aneurysm. While a significant amount of people die to aneurysms each year, they aren't that deadly. Most show no symptoms. However, they become dangerous when they rupture. Arteries carry blood away from the heart, and they must withstand great pressures, and thus they are thick-walled. In this diagram, the red tubes are the arteries and the blue tubes are the veins. Aneurysms can take on two physical forms. All sides of the artery can become weakened and bulge, which is known as a fusiform aneurysm, as you can see here. Or one side of the artery can bulge or balloon out, which is known as a saccular aneurysm, as you can see here. Aneurysms are classified by the location in the body. There's aortic aneurysms, which occur on the aorta, which is also the main artery. Cerebral aneurysms, which occur in the arteries in the brain. And finally, there's peripheral aneurysms, which occur in the peripheral arteries. If an aneurysm is unruptured, it will generally show no symptoms other than a pulsating feeling, but they can affect the blood flow to nearby tissues. If a cerebral aneurysm ruptures, the patient will experience the worst headache they've ever experienced and potentially lose consciousness. If an aortic or peripheral aneurysm ruptures, it will result in severe pain in the area, and it can also lead to angina. While the cause of aneurysms is unknown, we know of some factors that can influence them. Increased blood pressure can weaken an already fragile artery wall, causing a rupture. If the artery has been damaged, for example during a surgery or a dissection, this can also weaken the walls and lead to a rupture. There are several risk factors that can lead to or progress aneurysms, smoking tobacco being the most important. Others include high blood pressure, obesity, an inactive lifestyle, poor diet, and genetics. So you might be asking, how do doctors detect aneurysms if they don't show any symptoms? Most of the time they don't, unless they do display symptoms. They can come up on a scan or they rupture. They are genetic, so if anyone in your family has had one, chances are you have one too, and your doctor should send you for MRIs every few years. If the aneurysm ruptures, it's a medical emergency. So how do the surgeons repair a ruptured aneurysm? First, the surgeons will make a small incision either in the groin to access the femoral artery or in the wrist to access the brachial artery. They will then guide a catheter tube up to the aneurysm with a guide wire inside. So if it's a saccular aneurysm, where it bulges out on one side, the surgeon, whether he inserts the catheter tube through the groin or through the wrist, will guide it up to the site of the aneurysm using the catheter tube. And then once it reaches the site of the aneurysm, a guide wire will be deployed, and from the guide wire, platinum coils will be inserted into the ballooned area, and they'll just loop around and effectively seal off the balloon part from the artery flow. And the platinum coils are very soft, so when the aneurysm finally compresses, the platinum coils will not obstruct blood flow at all. In addition to this, a stent will be inserted. A stent can be inserted into the wall surrounding the aneurysm to further support the integrity of the artery. And this is what a stent looks like. You can imagine the artery as a concrete tube, and then the mesh or the stent just functioning like reinforcement. So those reinforced metal pipes in reinforced concrete. That's effectively what the stent does. It just reinforces the structural integrity of the artery surrounding the aneurysm. If it's a fusiform aneurysm, a stent will be inserted. People with aneurysms can live full lives, so some people don't even know that they have an aneurysm. As long as they live healthy lives by maintaining a healthy blood pressure, they manage their weight, they eat healthy, and they don't smoke.